So let's see, it takes 13 seconds to get go there. So he's got to unmute himself, and then we'll be able to bring him in just a moment here. Hey everybody, welcome in. My name's Jim Deedlow. Do some stuff in the noontime hour and talk to some pretty cool people in the community. This one is Midwest Interventional Spine Specialist, and that would mean that it is Dr. Sean Kondamuri, and he's got a lot to talk about today. And Doctor, how are you, my friend? All right, Doc, you got to go down there and unmute yourself on the lower left, okay? There you go. So I can, let's see, you are muted in some way. I'm getting no audio from you right now. Try it again, will you? How you doing? Anything? Nothing. Talk to me, will you? Yeah, I can see your lips moving, but I can't hear you. So let's see what that problem is. Let's see, ask to unmute. All right, so now he is unmuted. Let me see. Now, let's see. All right, on my end, you should be good. It's unmute my audio. There you go with Alt-A. What is that? Let's try this again. Look at that. So I am getting, are you getting me? Can you hear me? You can hear me now? Yeah, you can hear me now, right? So, all right, I see your lips moving, so let's see here. Why is that not coming through? Let's try it again. All right, can you hear me now? Yeah, I'm not getting anything. I unplugged the speaker, and that was not getting it. So let me think about why that would be. I'll tell you what, Doc, I'm going to log out of this room and log back into it. We'll just do it live. How's that sound, huh? So we will, this is what you call doing a little bit of troubleshooting live on the air. So let's see. We'll try going back into the room, and let's see if he's able to get in here correctly. All right, mute, stop video, nothing, all right? So when doctor comes in, see, these are the good ones you guys get when you get to see us trying to figure it out live on the air. I was watching, was it like the Today Show, and they were doing it live on the air. That's a little different area there when they can't get it to work. All right. So let's see if we have anything now. Now I see him better. All right, Doc, I see you're muted in your thing there. You see it? Yeah, so now your mute is off. Okay. Okay, there you go. I will ask to unmute you. All right, stop video, make report, put in waiting room, ask to unmute. All right. So now it's open, and you should be hearing you. This is what you happen when you get a doctor and a radio host trying to figure out an audio problem, huh? All right, so I am going to do something here, Doc. I'm going to make sure that I can play, that I'm still playing audio, and maybe it's not my fault. So give me 1 second, and I will play a Hey Jed, and let's see if that plays on the air, and if not, it'll be me that's the problem. All right, let's try that, huh?
Hey, want a quick request for Monday? It's Monday. Wow, what a weekend. Don from Couts here. My wife, when I first met her, had this on her ringtone. Who Can It Be Now by Men at Work from the Business as Usual album. Let's have a great week, Region, and use this app to the fullest.
All right, so Doc, I'm playing audio. Do you got any? There's got to. Can you go into your microphone? You're down here where it has a little sound thing in the lower right, and somehow get into your microphone, because you got a mute on probably on your microphone itself. Because my sound is playing fine there. All right, there's no mute there. Anybody got any ideas for the doc? Zoom meeting is using your microphone. Okay, good enough. I'm good. You guys can hear me. I'm talking. Isn't this fun? Uh, I'm not getting any sound off you, Doc. This is, let's see. All right, microphone array. Let me see. Let me try another thing. All right, keep talking. Nothing there. All right. All right, give me a thumbs up if you're hearing me talk. Are you hearing me talk? Are you hearing me? Yeah, okay, you're hearing me, so we're good. All right, let's put him on here just so we could look at him. There he is. Hey, Doc. Has anybody got any ideas here? Because I think it's on his computer. Allow participants to unmute themselves. All right, there you go. Try that. Let's see. Allow participants to rename themselves. All right, play sound when someone joins. All right, there you go. I think, yeah, Doc, I don't know what we're doing. This is kind of almost funny at some point. Jumping Jack flashes in the background, though. I hope that doesn't show up on Facebook. So if you're just joining us, you get to see us trying to figure it out. All right, I see in the lower left of mine that it says that you are muted. So, all right, show that up a little higher. Go higher, a little higher. I can't read it. This host is not allowing participants to unmute themselves. Okay, so then it maybe is on me. Let me see. Allow participants to unmute. Try it again, okay, on your phone. Because in your lower left, you're still muted, and I have allowed participants to unmute themselves, okay? So there you go. Maybe you can unmute yourself now, all right? Yeah. It still says, huh? Yeah, that's crazy. All right, I'm going to try it one more time. Log in on your phone, all right? And let me get rid of this. And this will be our, what you call our... live troubleshooting, okay? And I am going to, there you go, I'll try it one more time, but there it is. So let's see what is going on. It says something about muting and not muting, and allow participants to unmute themselves. All right, there you go. I have allowed you to unmute yourself. Well, what I can do is I'm going to end this and start it again. How does that sound, all right? Unless he's able to talk to me right now. Let's try it now. Hi. Hello. Knock, knock. Doc, how are you? Can you see me, Doc? I see you. Are you hearing me? Can you see me? Tell me. Allow people to unmute themselves. I've done that. All right, let's see. I got them both. I got them twice here. Look at this. I've got Doc on twice. So let's see what happens. Doc and Doc. All right, Doc, talk to me. Hello.
How's this, Jim?
Yes, it's coming from the bottom one. What is that, your computer?
The bottom one is my computer.
Or is it coming from the top one?
Let me cancel the bottom one.
No. The computer, I think, is working.
Yeah, so the bottom one is my phone. So I'm going to leave my phone.
All right. How you doing?
I'm good. Can you
look at that! It's working! Wait, are you on phone or on computer? People like that stuff, by the way. I do it in the morning all the time, and they're like, hey, it was kind of funny,
All right, so let's reposition here, okay?
You're on a phone now, right?
No, I'm on my, I have a desktop computer that I'm on.
All right, so it's not, you were on a laptop before.
Before I was on my laptop.
Yeah, something on that, is that an Apple?
It's a Mac, but this is the one I use all the time.
Yeah, and I've had this problem before. There's this like weird kind of idiosyncrasy to Macs. Now, let me guess. This is like a Dell or an HP or something, or what's this?
This is also a Mac.
It is. Well, all right. Well, maybe it's just the laptop, but you sound really good, by the way. It's a great. Does it
sound better?
Yeah, it actually sounds a lot better. All right.
Well, if that works.
So there he is, folks. It took us 9 minutes and 42 seconds, and we're going to leave it up there. I could have restarted the whole thing, but that would have taken the mystery out of it. Hey, he's Dr. Sean Kondamuri with Midwest Interventional Spine Specialist. You know, in a weird way, Doc, it's kind of like these sports seasons starting just a little bit late. You know what I mean? Kind of like us. It took us a while. They don't know if they're having practices right and stuff. But before we do that, let's remind people, Midwest MISS, you've got 4 locations, and I know what they are, but go through them again.
Yeah, so we're Midwest Interventional Spine Specialists, or MISS, and we have 4 locations, one in Munster, one in Chesterton, one in Hobart, and one in Dyer. And we take care of patients in northern Indiana and even out to the southern suburbs of Chicago and from Chicago itself. And we treat people with chronic back pain or chronic spinal pain. We get people back to normal lives so people can, enjoy vibrant, energetic, healthy lives instead of suffering through pain and stiffness and inability to do things. We want people to get back to normal lives.
And Dr. Sean Kondamuri is obviously not just pain and spine, but kind of takes the whole body approach. And I have convinced him that he's a great communicator about health issues. So we can take on just about anything you want to talk about. But 2 and 9.
I'm afraid to have given. I might regret giving you that opportunity, Jim. But I'm fearless. I don't mind telling you anything I know. At least I don't know everything, but I know what I know.
Yeah, we like your attitude about like just kind of trying to go about it common sense, especially during a pandemic. I believe that during this pandemic and social unrest and election, there's so much stress and there's so much physical and emotional stress that often I know that I need to be kind of stable on the air, and I took a week off last week. And a lot of times people just need to hear that there are folks that understand what they're going through and they have confidence that we are going to get through it. And I think you provide that. Hey, I had the one woman tell me, I forgot about this. You could have just called in to the Zoom meeting, which is another option. But we're working now. Doc, in prep for this, I was looking around on the internet, and before we get to professional sports, I saw that one estimate by a doctor was anywhere from 20 to 30% more injuries outside of competitive sports right now. And a lot of those are in the lower back where you guys do a lot of work. And there's a lot of hip stuff. There's clavicle, that kind of stuff. Stuff you maybe not see as much, but all of a sudden you're seeing this increase. Can you comment on that?
Well, I mean, it because of COVID-19 and because of, social isolation from March till pretty much July, March, April, May, June, July, it's 3 or 4 months that, our student athletes weren't really out there doing as much as they might normally do. So they lacked a lot of preparation and training that might have prevented some of these injuries. So they're young, they feel invincible, they feel like they can do anything, and they feel like they don't even need to get to properly train sometimes, and that they can just get through it. I mean, just knowing my own children and other kids, I know that sometimes they will not stretch like they should. Sometimes they'll not warm up the way they should. And these are all going to lead to injuries. So it's not surprising it's happening. I mean, since they're not elite athletes or not pro athletes, they don't have the luxury to have have what our pros sometimes have.
Well, let's talk about a pro. And last night was an excellent Cowboys-Rams game. I was watching it, kind of falling asleep in and out of it. But the Rams had a couple, the Cowboys had a couple of big injuries for the first game. Now, typically the NFL would play, they used to play 6 exhibition games, and it got down to 4, then they were going to do 2. But now they're not doing any. They go right into the season. They lost Van Der Esch, the middle linebacker, and tight end, Blake Jarwin. Both of those are starters. One of them was a collarbone, and then the other one was just a non-contact MRI on it. They did an ACL. Why? This is just the Cowboys I was looking at. Pretty much across the NFL, they had major injuries in about half the teams yesterday. That's a pretty high rate.
Absolutely.
What are they doing, and what can they do to help prevent that?
They're trying. I'm sure they're doing everything they could possibly do. considering the circumstances. But I think you hit part of it right on the nail on the head when you said they don't really have any preseason games now. Those preseason games are sort of, in a sense, it's almost like a warm up. You're getting your body used to. They're not going to go necessarily all out in a preseason game because it doesn't count. And they can, if they feel like they're sore in some part of their body, they can step back and they put somebody else in. They put a second string person in. But when they're playing and it counts, it's a real game, they're going to go out and they're going to get injured. The clavicle fracture, the collarbone fracture, there may not have been anything they could have done related to that, because if you fall the wrong way or if you hit the wrong way, that bone is going to fracture. But when it comes to a knee injury, I mean, they may not have had the proper, flexibility in their lower extremities, in their legs. They may not have had the proper muscle development in their lower legs that they're used to. They're just not as loose, perhaps. So I think a lot of that has to do with just getting warmed up and getting ready to go.
I agree with that about being loose, but I played tailback there for Munster High, and I remember moving my way into it, and I always felt like it took you a little while to remember how to fall correctly.
Yes.
And if they don't tackle you the first few days and stuff, and then all of a sudden you're hitting each other, and then all of a sudden you learn kind of to roll. Some big, goofy Hobart guy's going to tackle you. He's going to tackle you, and you're both going to kind of roll rather than just going splat onto the ground.
Right.
He doesn't want to go splat. You don't want to go splat. Everybody learns to roll. That's what I worry about, is they got to relearn these motions. If you go right into a full contact NFL game, you ever go on the sidelines in one of these by any chance on a?
Oh, for sure.
Yeah, I mean you have. I mean, you're on these NFL games, and I've stood on high school, stood on college. But you stand on the sideline of an NFL game, I swear to God, it's going faster than you could even imagine. And if you're right there, I mean, their bodies just, I can't even imagine how they're catching up at this point.
And just really the distinction between from high school to college and from college to the pros, their technique and the skills that they have are, the distinctions are so small. You look at a soccer player, a high school soccer player, you look at the best player at like Lake Central, a midfielder or something, he looks really good. And then you compare him to a college player, and the college player clearly looks way better. But if you compare the college player to a pro, you might look at the college player, and if you're not a soccer player, you might think, what's the difference? They both look pretty good. They both look the same. But they're clearly, the training is so much more intense with each level. And the skills that they have, the demands that they put on their body are so much more intense. And if you're ill-prepared for that sporting activity, you are ill-prepared for the demands of the play, you're going to get injured. And that's a reality. I mean, you have, like, the U.S. Open just finished this weekend as well. If, as you know, they almost canceled the U.S. Open. U.S. Open tennis, I'm talking about.
Yeah.
They almost didn't have it. Wimbledon was canceled in July, but the U.S. Open decided to go forward. So in New York, they conducted the Open, but all those players were literally in a bubble. They had no contact with anybody, so the risk of getting COVID was pretty much eliminated, or at least reduced significantly. And they've been training all through these last 6 or 8 months, but still injuries occurred. In that final, I'm not sure if you saw the final, Jim, but the guy, Dominic Thiem, who won, he came back from being down 2 sets, and he worked so hard in the last 3 sets, and he ultimately won the match. But he was cramping up at the end of the 5th set. He was cramping up, and you could see him limping. So this guy probably has been training pretty intensely these last 4 months, but still probably not like he would have last year, because he didn't have a warm-up match. He didn't have Wimbledon to play beforehand 1 month ago to come into this tournament. I mean, there's a lot of, just in the same way, if you don't have preseason games, our bodies are just not used to that, even the elite athletes.
We're talking to Dr. Sean Kondamuri, and if you got any questions or anything, you could put it in a Facebook comment, or you could call us at 219-845-1100. Doctor, the U.S. Open of golf is coming up this weekend in New York. And in a weird way, one of the things that we haven't seen are a lot of golf injuries. And part of it is that they've basically been playing the all the way through. And some of the guys that I know that play golf that typically have the bad backs, especially, they've been able to, I mean, it's so popular now. All the courses are crowded. You can't buy a driver in some of these places, and you can't find a good putter. All the equipment's being bought up, and golf has just gone through the roof. So it's kind of the flip side. A lot of these bodies are ready for golf, whereas in the past they might not have quite been there, and you might have seen a lot more golfers, early on in the season. So the U.S. Open's coming up this weekend. They all walk, of course, but explain why they're. I mean, I kind of gave my answer on it, but you're not seeing professionals, and you're not really seeing that many amateurs right now. If far from my side, just plain old use or what?
Well, I think it's a little bit of what you said, Jim, but they're also not contact sports. You're talking football and basketball; those are contact sports, and you need to be prepared a little bit to just get hit. I mean, you can train as much as you want for 2 or 3 months, but until you actually get into the arena and you actually get hit a little bit, and like you said, know how to absorb the hit, know how to fall, know how to actually be on your feet so you don't get these sort of injuries, they're going to happen. So the training was probably a little bit truncated, right? At least in football, high school football, college football,
and soccer,
all those contact sports.
Yeah.
But in golf and tennis, it's your own body against gravity and your own body against the ground, and your own body against the forces of the swing and that kind of thing. You're not really dealing with the actual injuries that occur from contact with another player, another 300-pound player.
All right, so there's Scott Kingery, plays for the Phillies. He had some back spasms early on, and he's not been able to play at all. He just can't get the spasms, and they're not really seeing much other than like a lower back tightness that they're saying really needs a few months just to sit, but he doesn't have it because the season's so truncated as we're talking about. I mean, what can the average person do with a little bit of tightness in the low back? If Scott Kingery can't get past it, how are we supposed to get past it?
Kingery needs to come to Munster, Indiana, and see me, and we'd take care of it. Because that's not that complicated. It's hard to treat. I'm not saying it's easy, but there are a couple of very common conditions that aren't going to show up on an MRI scan. So obviously he didn't fracture something, otherwise that would have showed up on an MRI. He didn't tear something that would have shown up in an MRI, but he probably traumatized the joints in his back. Those joints are called the facet joints, and the facet joints line your spine from top to bottom, and there's one on each side. There's two, every level has 2 facet joints, and those facet joints get traumatized in an athlete, a young athlete, a professional, or an older individual who's got arthritis in the spine. And when those joints are traumatized, we try to figure out what joint it is, because when the joint is traumatized, the muscle on top goes into spasm. That muscle spasm is probably because of something underneath. Because if it was just plain muscle spasm, the athletic trainers would have eliminated that spasm with all the treatments that they provide. They use a lot of great, obviously he's got access to the best massage in the world. He's got great massage therapists, great athletic trainers who are working on him. They're giving him ultrasound, they're giving him electrical stimulation, they're stretching him out. All of that ought to solve a simple spasm. So what it tells me is that there's got to be something underlying the spasm that's keeping the muscles in spasm. And the most common situation in an athlete like that who gets injured, who has not herniated a disc, who has not broken something, is a trauma to the joints underneath. So we find those joints and we can eliminate the pain from the joints by doing some simple treatments on those joints, simple injections. We can actually take away the nerve supply to those joints by killing the nerves in a very minimally invasive way without cutting you open. And if he did that, you can get relief. I mean, that is something that definitely can be done, but they're probably going to rehab him for a while and see if they can get better with rehab. And then later on, look at other options.
Doc,
like
yeah, they have really not been able to do that because he starts to come back and then all of a sudden it tightens up on him again. And they're just, and evidently he's not the only one. He's just one of the guys I was reading about and follow on the Phillies. And, that's a really nagging injury that you could get in any season, but it seems like it's more common right now.
Sure. It's even common in golfers, Jim. Even Tiger Woods and some other golfers have similar problems. Tiger Woods, of course, had blown out his spine and he had a lumbar spinal fusion done, but he also suffered from facet joint problems. And those joint problems are things that need other treatment, like what I'm talking about.
We're talking to Dr. Sean Kondamuri of Midwest Interventional Spine Specialist, MISS. And Doctor, let's take a little bit more of a whole body approach. In terms of like the general stress and anxiety and physical and emotional, it seems as if it kind of came on real strong in March and April and May. Then maybe we got a little bit of a lull in like July-ish, maybe even through August. But we're coming into a time now where people are kind of stressed about school. The numbers are spiking in a lot of places right now. And we're going into some really contentious election seasons. What can you tell people about dealing with the physical and emotional stress going forward?
Well, so first you have to, I think everybody knows, most everybody probably realizes this is not finished. I think Indiana has something like 9,900 cases right now, a little over 300 deaths. The state of Indiana has about 110,000 cases, and I think almost 3,500 deaths. So those numbers may increase in certain areas like Marion County around Indianapolis, and certainly Lake County where we are. We're going to see some more deaths. So what we definitely don't want to have happen is have us all shut down again. Nobody wants that. I don't think anybody wants that. But the only way we're going to prevent something like that is if the cases stay down. And there's a little bit of stress around that because some people don't believe in wearing a mask. We have to wear a mask in the office all the time when we're in front of patients. Some people believe in that. Some people don't believe in it. That creates the stress. And all these stresses are all part of coping with COVID-19. And coping with COVID-19 is awfully difficult when it's always around you. So it's hard to shut it off. So sometimes one of the biggest things is not only do you want a social distance, but you want a media distance. And I think I mentioned that before, at least stop hearing about it. And I know that I don't talk to my friends much about it anymore at all. We don't really talk about COVID unless there's some specific, patient or something who had a problem. We're not talking about it because all the safeguards are in place. So it's business as usual now, as long as you maintain all those safeguards and social distance and wear your mask, whatever. But I think people who are not physicians or in the community, they should do what they've been instructed, whatever they're willing to do, and then live life as normally as you can, because you can't control what you can't control. So we don't want to stress over things we can't control.
Hey, Doc, one of the things that I have taken to personally over the COVID is doing a little extra heavy exercise. And one of those is I've been riding my bike. So I went on vacation last week, and I went into the hills of southern Indiana. We rented a cabin, and I took my bike, and wife and I go for a bike ride in the morning. I'm like, you know what? I'm going to go again in the afternoon. So wow. I go about I get about 10 miles away from the cabin, maybe 8, but it's all up and down. So I'm already just kind of chugging pretty heavily. And then I realize I'm 8 miles away over up and down hills. And when I left, it was like 84 degrees. All of a sudden it was 94, and there wasn't any breeze. And it was the first time that I ever really think that I kind of almost overheated on a bike. We do have a little bit of heat coming in the next few days. A lot of people are biking pretty heavily. I know you're a biker. Specifically, what do you say to the bicyclists about dealing with the heat?
Of course, hydrate. Absolutely. You got to overhydrate. And one of the problems is when you go on a long ride like you're going on, Jim, you're going on a 30, 40, 50, 60-mile ride, you have 2 bottles is all you can really carry with you. And those 2 bottles run out of water. You run out, especially if it's super hot like that, because you really do have to hydrate. So you got to figure out a way to get more water, get more electrolyte solutions in you. That's the number one thing. It's just the hydration and just general overall health. Make sure you're eating well, make sure you're drinking well, and make sure you're loose, because there's not really a great answer. If you're out on some country road and you're on mile 50 or mile 60, and it's 95 degrees out there, you're seriously hot, especially when there's no breeze.
I don't want to represent that I'm like you. I mean, 20 miles is a long way for me up and down, man. Believe me, I like to just chug and enjoy the ride and stuff. Sure. But I got back and my wife's like, I had my shirt off, which I never do, but there's country roads, nobody sees you. She's like, what is your problem? You could have just fried somewhere. No one would have seen you for hours. So anyways, I know you and I have talked about the hydration, and I didn't have anything on me. And then, like an idiot, there's a gas station, and I'm driving right by it. I go, oh, my God, they got to have Gatorade in there. I don't have my wallet on me. So anyways,
I don't have my wallet on me. I don't really have my wallet on me either. But most places you can use your phone, right? Apple Pay.
Yes, and I haven't set that up yet. I'm in on that. We're talking to Dr. Sean Kondamuri. Sean, you've been riding a lot still?
Yeah, I'm trying to. I try to get out at least on weekdays, like 2 or 3 weekdays for at least an hour. And I try to at least do one weekend ride. But, you talk about sports. My son's a tennis player, and every Saturday we're out somewhere in Indianapolis or Fort Wayne at some tournament. So I lost out on a lot of my morning rides. We leave Friday night. So I lose my Saturday rides. And actually, speaking of bike safety, the group that I ride with sometimes on the weekend, last weekend when I was away at a tournament, they went out and they went out in a big group of 20 guys, and they had somebody slipped and some bike went down, and they had a big a bunch of bikes tumbled, and there were 3 guys who had major injuries.
Really? Is that the Starbucks guys? Did you guys? Is that the
Yes.
Yeah, I've been invited to that, but I am not your guys' level, and I will not embarrass myself. I know a couple guys in that group, and
a few guys got badly injured.
Oh, I did not know that. That's too bad, man.
Ribs, things like that.
Wow.
As fun as it is, it's just like anything. If you're on the road on a bike, which is becoming super popular now, as you mentioned, Jim. I mean, so many people are riding bikes now because you can't do it. You can't go to the gym, or you're afraid to go to the gym. So bike riding becomes super popular. People are riding on roads. You got to have lights on your bike. Got to have flashing red lights on the back of the bike. And if you're especially when you're in traffic, and you've got to wear reflective clothing, and you got to wear clothing that really, the reason bicyclists wear more serious bikers wear the really wild colored jersey, right? Because you want to be seen. Yep. You want cars to see you. Because you can't see them, and if they hit you, it's a mess.
Yeah, it looks kind of It looks kind of weird sometimes, but it's not just for nighttime. You're there because they want to catch you out of the corner of their eyes. That orange and lime green kind of
multicolored crazy jersey.
Yeah, you got it. He's Dr. Sean Kondamuri. We could talk for hours about this stuff. But Doctor, thanks a lot. Doctor's with Midwest Interventional Spine Specialist. And we come on like every other Monday, and we talk a lot of different things, including back pain and anything like that. Anything else you want to mention?
No, I mean, I think you brought up that great point about facet syndromes. I mean, the joint problems in the spine can affect the elderly from arthritis, can affect somebody after an injury like a car accident or a fall by a tiny microfracture in the joint, and it can affect athletes from a tiny microfracture that you can't even see, and inflammation in the joint, which affects the nerve, and those are problems that are very, very treatable without surgery. So, seek some help, and people are out there to help you with that. You don't have to suffer.
All right. It's not just Dr. Sean. There's, 4 other doctors and some PAs and stuff like that? Exactly. There it is. Big practice, and Doctor would love to talk more about cycling, but we got to cut him off because they keep buzzing him to go see his patients. So there it is. Doc, thanks a lot. We'll talk to you.
Thank you very much.
All right. There's Dr. Sean Kondamuri. Let me end that there. And if you want to be part of the Community Programming Initiative, all you got to do is email me at jed@WJOB1230.com. We're on the radio right now. We're on the video, streaming live in video and in audio on the TuneIn app. But I'm going to end all of that. And all that talk about a bike ride, I'm going to go do right now, because right here in the Calumet region, if you happen to be catching this later, it could not be better out. It is, 72 degrees. It's dry and sunny, and it has been raining, so there's plenty of lush greenery around. So I'm going to end it, and I'll see you within about 40 minutes. I'm going to be on the trail over there